Hello, I am Dr. Girish SP, GI surgeon at Aster RV Hospital. Today I will be talking about gastrointestinal cancers. As we all know, cancer is the leading cause of death in humankind. GI cancer, that is cancer related to the stomach, abdomen, it's one of the most common cause of cancer. It involves organs like stomach, large intestine, pancreas, and liver. These are the most common causes. There are other causes like small intestine and duodenum, etc. But these are the least common causes. In this, we have types of cancers. Most common cause of cancer is adenocarcinoma. The other causes are lymphoma and neuroendocrine tumor, and also something called gastrointestinal stromal tumor. So, as we all know, the most common symptoms are stomach pain and maybe a bleeding from intestine, which comes in the stools. As sometimes it can be dark color stool, we call it as melena. It is, if it is in the stomach, when it comes all along the intestine, so it can cause denature. It gets denatured and causes what is called as melena, which is a black color stool. So patient can have loss of weight, vomiting, or generalized weaknesses. And when we evaluate them, we may do a regular endoscopies, we can do a CT scan. Then to know the spread of the disease, we do something called as a PET scan. It is a specialized scan which is done for the whole body. We not only diagnose the primary cause, the primary source, we also know whether it has spread to any other parts like bone, lungs, liver, etc. Because most of the time the liver tumor is secondary, which has come from the intestine or from the stomach. So it is very important to know it has spread elsewhere, because what we call as a staging of cancer, when it has spread to lungs or liver, it is called as a stage 4 disease, where the treatment is totally different. Then we also do sometimes some biopsies. It can be done through the endoscopies, or it can be done directly by puncturing the skin through a scan guidance. So this is the very important step in diagnosis, because what is the type of cancer is very important. So as I told you, the most important or most common cause is adenocarcinoma. When we diagnose it, according to the stage, when it is limited to this organ, for example, if it is within the stomach, then the treatment is different from when it has gone outside. When it is within the stomach, then most common type of treatment is surgical. Then we may add, or we may do a chemotherapy beforehand or after the surgery. It depends again on the different type of sub classification or sub staging. So in our hospital, we have adopted a new technique, that is minimal invasive surgery, a laparoscopic or a robotic surgery. So the best advantage of this method is that we do a very small cuts, very minimal cuts, and we can do most of the cancers, like even the pancreatic cancer. So we have one of the major operation called Whipple's pancreatic duodenectomy. Even that we perform laparoscopically in our hospital. So the cut is very small, the recovery is very faster. We are always afraid, like in elderly patients, when we do a long cut, the fear of pain and recovery time is the worry. But with a laparoscopic, there is a greatest advantage that we do this procedure with a very small cut. Very next day patient can get up and walk, because the pain is very minimal. Indirectly, the painkillers are less, so the patient, the ILS, what we call the intestinal movement, is faster, the healing is faster. So we have one of the best comprehensive cancer care unit being set up at our hospital, where under one roof we have a medical gastroenterologist who can do diagnostic evaluation, or the palliative treatment like endoscopic stenting, or bleeding control by giving a glue injection through endoscopy. And of course we have the surgical team, where we can perform most of the operable cancers can be performed through minimal invasive technique. Then we have adjuvant treatment such as chemotherapy or radiotherapy. We have one best of the leading doctors available in Bangalore, and then we are well supported by a radiology team which can perform the diagnostic evaluation as well as the intervention radiology for any bleeding or any complications, which can be done by percutaneous methods. And we have good support of laboratory where we need blood examinations or blood bank support, as well as diagnostic pathology, which is most important in diagnosing the disease as well as the staging of the disease. So in all respect, I think we'll have one-stop solution for the GI cancers in our hospital at Aster RV Hospital. And we conduct 24 hours OPD services all days of a week. Thank you.